not only a place of mercy in our context between our walls, but how do we also become a place for the community and those that are serving folks in different capacities, whether it's the VA, whether it's, your office, whoever those folks are, how can we begin to come into community and having conversations and connectivity to collaborate when the folks from New Jersey show up at the front door, right? That I respond in the way that I know. I'm going to pray, I'm going to call my sisters, we're going to band around. But there was a point in time during that story that you realized I'm over my skis and I don't know what to do. And so we're going to talk a little bit about how we, as the church, have been invited to be a part of the conversation to best serve in those kind of situations. And so that's the hope for today. So is that kind of in accordance with what everybody was expecting? Mm-hmm. So what you're going to get a little bit today is you're going to get a little bit of the why. And then we're going to have two kind of classes that are part of a bigger structure of classes. You'll walk away with some toolkits. You'll walk away with some resources that you're going to take back to your church, that you want to share with other church members that you know from other communities, take back to the Baptist folks that you're meeting with on that Third Street project or whatever. You'll have some things that you can take back to them that are evidence-based tools that we're using all over the country and to help in this particular situation. So the beginning part today, I want to kind of tell you where some of this information is coming from. And so I'm a part of Governor Mike DeWine's Recovery Ohio initiative. I act as the faith liaison for that. There's 15 of us on his advisory. When he was sworn in at 12 o'clock in his house in Cedarville, the first thing he signed into law or into an executive order was Recovery Ohio. So our governor has been intensely involved with recovery ever since I've known him. He actually lives not too far from me in my community. He's a prosecutor, and he's a senator, and he's lieutenant governor, and he was attorney general. And in this context is where I got to start to know him when he was the attorney general. And we went through a lot of stuff I'll tell you about here in just a minute of engaging the church when he was the AG. Because if you know anything about Dayton, Ohio, and I live just outside of Dayton, Ohio, about 2015, 2016, Dayton, Ohio was on every national news broadcast as ground zero for the heroin epidemic. Our overdoses per capita were the highest in the country. CNN was there, NBC was there, Lester Holt was there, everybody was there. We had a period of time where we had refrigerator trucks parked around all of our funeral homes because we didn't have enough space for all the bodies. So it was a bad, bad time in Ohio. And so when I got engaged with this, in some of the capacity I'll talk about here early on, it was in that construct. It was in that time where it was really, really bad. And so our Attorney General, who's now our governor, put his hand up and he said, I need the church to help me because I'm out of my own stuff. And I think you guys could be an amazing resource to help me. How do we do that? And we'll kind of walk through that a little bit. So I want to show you something that's going on in Ohio right now, and it's called the Opioid Education Alliance. And so part of what we're going to try to do today is we look for some E's, and you'll see them here in a minute. But one of the things I want to do is I want to make sure that we educate today. Now, we have some professionals in the house that I'm sure could probably do a much better job in some of the education than I am going to do. But we're going to try to provide a baseline of education around this idea of addiction and mental health. But when you guys said, yeah, I really want to talk about stigma, I want to kind of give you a feel for what's happening in Ohio when it comes to stigma for substance use and mental health. It is a very concerted effort by an organization called the Opioid Education Alliance. And so I want to show you this little video of what they're doing to kind of give you a feel for where we're coming from. And this is something that potentially we can help to bring to Georgia if it makes sense.
I didn't choose to be a drug addict, and that's not what my purpose was in life. I just feel like if the world was a little more educated on, like, the disease part of addiction, then maybe they would have a little better understanding.
That's why I really felt helpless and struggle, you know, because I felt like nobody understood me, nobody cared, everybody judged me, everybody just looking at me, and, you know, it hurt. When I wasn't talking about it with someone, I was battling it by myself, and I kept losing, I kept losing, I kept losing.
I've been told that my son's death is Darwinism, that is, the thinning of the herd, that if they found him ever drifting in the street, they'd step over him and keep walking, all because my son had a mental illness.
So many people seem just damaged, whether they were hurt by their family, whether something happened to them, and they've never been forgiven or more or less forgiven themselves. Most people come to our specialized dockets aren't bad people. They're not hardened criminals. There's somebody who's put in that position for some reason. All these things we see contribute to the mental health issue, which often heads to addiction issues.
The way that I think about it sometimes is, you have a toothache, you go talk to somebody about it, whether it's your parents or your dentist, and you mention it, and you take care of it before it gets out of hand, right? But what if, you know, we treated that toothache the same way we treat addiction? You know, what if that person felt ashamed about having a toothache, and he just didn't talk to anybody about it, and then a few months later, that tooth has to come out? You know, that's a permanent, situation to be in. You no longer have a tooth. My situation, I no longer have a brother. I think we would still be here today if that stigma and shame or addiction didn't continue.
Well, we got to talk about this stuff. I mean, whether from the pulpit or you know, in community groups, as I've done, many times we're in public forums. You got to start talking, first of all, and you got to be real with people, and then you got to start listening.
Until we as a society accept that our brain is an organ just like the heart and kidney and anything else, and it controls all of that, and it can be disease.
We have to look at people as human beings. I think that's the worst thing we do is we look at them, oh, they did this, they're bad. Oh, they were this person, they're bad. Look at them as who they are and what they're worth. Everybody has a worth, and everybody has a value. And we should look at those values and stop just assuming what we know about somebody. Take the time, talk to them. That little kindness you show somebody might make a huge difference in their life down the road.
Hi, I'm Ryan Day, head football coach at The Ohio State University. Both my wife Nina and I know about mental health issues and how they can affect anyone. This is why we established the Christina and Ryan Day Fund for pediatric and adolescent mental wellness at Nationwide Children's Hospital. I never spoke about my experiences for many years. It's not a sign of weakness to ask for help, nor should it be embarrassing. Asking for help is a sign of strength. Condemning those living with diseases is not the answer. Addiction and mental illness can affect anyone, regardless of their moral character, willpower, or place in society. Nina and I are proud to lend our support to this initiative because it describes addiction and mental health issues as what they really are. Diseases worthy of our empathy, energy, and resources, not our judgment.
So I think that last stat is very telling, right? We have 11.5 million people in Ohio. 1 out of 13 has substance use issue. If we look at it on a national basis, when I get a little later into training today, 1 out of 5 folks in our country could develop a substance use disorder over the course of their life. Often, when someone has a mental health challenge, they'll wait 8 to 14 years before they'll seek any help for that, and that's rooted in stigma. And so when you have some time, I want you to write this down or take a picture of it, or I'll send it to you. There's a little game that we built in Ohio calling How to Beat the Stigma. We actually put this up at the state fair. We had a big pavilion of it. It's just 10 questions, and it's just really designed to have you kind of think and see where you're at in terms of how you view substance use and mental health. Are you part of the problem of stigma? And so when you get done, you'll have, I think it's 10 questions, you'll get score on that. But just take it down, you can Google it, Beat the Stigma Game, Ohio. But what I think would be helpful for you, in here, I think we've got a lot of folks that kind of get this, right? But as you're out talking to the person at the coffee shop, or the person that makes that comment, about that person, or they see someone, or, you just need to get a job, you need to pull your life together. You don't have anything wrong with you. Just get it figured out, right? This would be a good test for them to go take, because it's likely that all of those views are rooted in stigma. And so if our goal today is to end the stigma, this is a good place to start. And this is a good place to start a conversation. We put this out last year, right around the holidays. We knew people were coming out of the basement and coming out of the house and going to back to get together, for Thanksgiving, for Christmas. And so we said, hey, when you're sitting around afterwards before you start watching football or you wake up from your turkey nap and you want to talk about this is a way to start a conversation. Have a conversation when it comes to stigma. I think what you'll find is it's pretty, I think everybody in here is probably going to get a 90 or 100. But I know we have a lot of people that we intersect every day that probably aren't. And so if our goal is to reduce stigma, this is a good way to do it. The other piece of it is what we're going to talk about today is the importance of community and the importance of how much we need one another. Wheatley said it well. She said, our seemingly separate lives become meaningful when we truly discover how truly necessary we are to each other. One of the things that's happened in the recovery community, Ashley can speak to this, I know. In the recovery community is we have this camaraderie. There's a vulnerability, there's an authenticity that happens in the recovery community. I'm sure it happens here. You had Celebrate Recovery last night, right, Pastor? Mm-hmm. So inside this room last night, it was likely that there were a lot of people that really understood the importance of each other. And how did they have that meaningful relationship with each other? It's because each other was not putting up the wall, was not creating some perfect picture. There's authenticity and there's vulnerability. One of the hardest things for the church, Big C, to do often is to be in that place of vulnerability, to be willing to say, yeah, I don't have it all together. I don't have my life totally in order. I'm willing to share some of my stuff. I can be that prayer warrior. Yeah, I can be a Sunday school teacher, but it doesn't mean that I don't have stuff. And often, I know within the addiction community, there's the perception. You get called fake ass, whatever, right? And in your heart of hearts, you're not that, right? But it's an easy way to throw stones because there's this perception that, well, you haven't taken the time to invest. You don't understand me. You don't get me. Therefore, all that stuff you espouse is really not true. No, it's true. We just need to find a way to have that balance, to have the conversation so that you see it's true too. And that's hard. And it's really hard if you're in the throes, which she was, of whatever her challenge might have been. Whatever her PTSD was, whatever if she was actively in addiction. You weren't talking to her, you were being marshaled around by her illness, right? And that's tricky. Because it's hard to reason with the illness. It's hard to reason. We'll talk about that a little bit later this morning about what we call the hijacker. You can have a conversation with the hijacker. Because the hijacker is not reasonable. It's not this part of the brain, I'm sure you can attest to this, it's not working when all these other things are firing, right? It's my decision making. So today, the goals for today is to engage you. Hopefully you're engaged. Obviously you're here, and that's super important. We're going to educate a little bit. But I always want you to walk away feeling equipped so that you have tools like the Beat the Stigma game. You'll have some other things that you'll be able to download through QR codes as we go through today. Access to other video content. Access to all of this content. You'll have this deck. I'll send it to Pastor Sheldon and to Ashley. She'll distribute it to all of you. None of this stuff, this is an amalgamation of a lot of really smart stuff from a lot of really smart people that we pulled together in order to present to audiences like you today. So those are our goals for today. So here were the learning objectives that I set out, and hopefully if you saw the flyer, this is kind of where we're going to go. So we're going to explain the importance of faith-based engagement. We're going to give you something that's being done in other communities, something that we can apply to Gwinnett, to Conyers, to wherever you're at. A replicable community-based plan, how to get engaged with your community. And then give you some tools and trainings, not just today, but access to quite a bit of training. That, the good news is if you can afford to make a Hampton Inn and maybe a cheeseburger, you can get that doesn't cost you anything. And then there's also some stuff we're putting online that it'll be at a minimal fee to get through. So a little bit about me. These are some of the places that I intersect and work today. I mentioned Recovery Ohio. But a lot of our content today is coming from a partnership that we have with something called the Partnership Center. Health and Human Services in Washington, D.C. have a faith-based office. It's called the Partnership Center for Faith and Community Outreach. It's a small office. Dr. Q English is the director of that. Prior to her was Dr. Shannon Royce. The team there is 4 or 5, but they have the kind of the charge from Health and Human Services to engage the faith community on issues of public health. So most recently, the last 2 years, they have been neck deep in COVID. And so you saw some of that. Can your church be a vaccination site? Can your church become a testing site? A lot of that stuff was being driven out of that particular office. But what they also do is they have taken the initiative on other public health things like mental health and addiction, and continue to convene folks from all over the country that are doing work in a faith-based space to have these kinds of conversations. What are you doing at your church? What's working at your church? What are you doing in the workplace? Do you have a vocational opportunity for people that are coming through your church? Do you have a recovery home that's working? How are you helping people find access to higher education? Those kind of things. So quite a bit of our content today is going to come from that. And a couple of other things that are going to come out of today's content is my experience at a place called Woodhaven. I actually work as a community engagement specialist at Woodhaven. We are an alcohol and drug treatment center in Dayton. Today, this morning, I have 200 folks in the house who are receiving drug and alcohol treatment today. They'll be with us up to 90 days. We're a Medicaid-only facility. In Ohio, we have expanded Medicaid. So we have an awful lot of people that are there that society would have potentially thrown away. We have a lot of indigent care that we do. We have an awful lot of folks that sometimes Woodhaven's kind of the last stop on the train track. I've tried a lot of this stuff when I get there. But the good news is that Woodhaven is totally run by people who are in recovery. Our entire C-suite is in recovery. Our entire ownership group is in recovery. All of our community engagement specialists are in recovery. And I would say 95% of our employees are in recovery. And so what we build is an empathetic space to help people on that first 90 days of alcohol and drug treatment. And then the last piece I'll mention is Her Story. Her Story is actually the ministry that my wife is the chair of. And we built a home for ladies coming right off the street that we provide 30 days of respite care, physical care. We do some detoxification even in the house, and preparing them to get connected to other community opportunities. Why is that important to say that? Within that construct, we've also been able to figure out how we can bring faith into clinical conversation. So within the Her Story project, we've actually developed an intensive outpatient care model that's rooted in faith for women. So we provide clinical services 5 days a week through Her Story at a church that we bill Medicaid for. And it actually sustains the ministry. So Medicaid sustains the ministry. And that model that we're building out more and more. Some of the other content that we're going to use today is from this guy. And this guy will change your life. If you ever met this guy, he's out of his mind, but he's one of my best friends. This is Dr. Monty Burks. So just above you, in this great state of Tennessee, Dr. Burks works for the governor there, Governor Lee, and he has the Office of Faith-Based and Community Initiatives that he does there. Some of this stuff we're going to talk about today, he calls certified recovery congregations. I would say Park Place is a certified recovery congregation. You guys kind of get it without having to label. But across the state of Tennessee, he has this conversation all the time. And because I work with Governor DeWine, I don't work for Governor DeWine. He actually works for Governor Lee. So he's got about 20 folks that scour the state of Tennessee that are peers, that people in recovery. All 20 of his employees have had criminal justice intervention. They've all been incarcerated, everybody that works for him. And they travel the state and they look for opportunities like we're having today, to sit down with faith leaders, pastors, others, to have this conversation about how can my church, my little c, have impact on the big C, but also how does my little c become part of the big C of community when it comes to substance use and mental health. And so some of the content that we'll use today are things that he and I have now taken what we're doing best practice in Ohio, best practice in Tennessee, and we're putting that together. And we just went in the middle of the sandwich about 4 weeks ago and took it to an organization called Isaiah's House in Kentucky, where they're going to be what you kind of talked about. They're going to be the ones to take it out to other people. And so they have about 300 beds of faith-based recovery in Kentucky. So some of the stuff that we're going to see today comes from the Tennessee Mental Health and Substance Abuse Services too. The reason I mention that is want to take me out of the equation. This is a lot of folks who have provided this input from HHS, from the state, from other states, and then we've been able to, again, amalgamate this, to consolidate this into something that we can make, somewhat digestible in a small amount of time. So that kind of gives you a feel for it. So why faith-based engagement? This is a cool thing. This quote came from a guy that lives here in the great state of Georgia. He's just up the street from y'all, and he is a fantastic human being. His name is Kelly Moselle. We'll talk a little bit about what you have at your disposal just up the road that you may or may not know that's available to you here. The why are faith-based communities unique? They can be offered repentance, honest self-assessment without judgment, responsible living with spiritual devotion. Intervention and recovery is a holistic process. You hang on that today. That's one of those nuggets that you got to hang on to all day long today. Faith-based communities are equipped to minister to individuals and their families. Another key piece of the puzzle. While we have folks like your friend, there's all the dynamic of the family that's around her that have been marshaled around by her issue too. How are we serving the family? Congregations can provide a caring community. We have to be intentional about that because often we are perceived as not a caring community. We are perceived as something that's really hard to get into. I don't know how to dress. I can't get up on Sunday morning. I don't know if they'll let me in. I don't talk like them. I don't walk like them. I don't know much about that book that they read from. Do I stand up when I sing? Do I sit down when I sing? What do they do when they hand me that communion thing? What do I do with that? Do I take the bread first? Do I drink it first? What do I do? There's a lot of hidden rules in our gatherings that make our gatherings sometimes a little intimidating, right? So are we a caring community which fosters acceptance, nurtures self-worth, offers forgiveness, reconciliation, and supports spiritual healing and growth? Is this a spiritual issue? As Pastor prayed, yes, without question. Folks are oppressed by things from their past, things that are generational, stuff, right? So do we have that answer on the spiritual thing? Yes. But recovery is a holistic process, body, mind, spirit thing. So if we're not cognizant of the body and the mind as well as the spirit, often we can be perceived as all we want to do is slap somebody in the face with a King James Bible and they're going to figure it out. Can't do that. That takes a different approach to it. Because what we're dealing with is a complex thing. So our approach in all of this, what brought me here today, is this. We want to answer two questions. The first question is, what can my congregation do in order to better serve an individual with substance use or mental health disorder? That's the question. Second question we want to do, how can we better support the family as well? So what do we got in place for that? And here's the good news. A lot of tools, a lot of experience, a lot of people who have taken the position that they are stewards of what God has given them. Therefore, they want to give it away. What everything we learned today, my whole heart, I want to give it away. It's not mine. It's to help empower you, that last E that we talked about. So 3 things that we want to try to do in this first part, and then before you walk out of here today, you will have a little better understanding of what it is to recognize a substance use issue and a mental health issue. How do I recognize them? Am I going to diagnose them? No, you're going to leave that for him. But I can recognize it. I know something's up, something's beyond me, right? How do I recognize it? Then how am I going to respond to it? And I'm going to respond differently, right? We talked about that little church that's got 60 folks all from the Caribbean, right? How they respond to this issue is going to be very different than the way Andy Stanley's going to respond to the issue, right? It'll be very different than his daddy is going to respond to the issue, right? Just up the street. It's going to be very different than how Louis Giglio responds to the issue. It's also going to be different based on what Park Place is going to do, because you have your culture. You have your gifts and talents that are flowing throughout your building. Your body of Christ here looks a little different than the body of Christ at the Baptist church that's up the street. So how am I responding based on what I have? And then the last piece is the important piece. And it's the piece that you experienced. How do I refer? Your approach was perfect, by the way. You handled it perfect. You set the boundary. You did what you could do in the moment. You leveraged the tools that you had, your friends, your God. You prayed. You stayed safe, right? But you opened the door of opportunity. Gasoline, something, you get a phone working, directions to the VA. because she needed that. You gave her what you could give her in the moment, but you also, because you knew, opened the door of opportunity to refer where she needed to go. And I think sometimes as faith folks, we have this extra burden that we put on ourselves to think, oh, I got to fix it all. No, we don't. We can't. I can't fix it all. I'm not asked to fix it all. And the other part is it's sometimes a very vulnerable position to be in, because we tend to be pretty self-reliant, pretty successful. I kind of got an idea what to do. I'm a solutions person. I solve problems all day at work. Yeah, she able to solve this problem, right? And I think what the Lord sometimes puts us in these unsolvable situations, so what? It creates dependency on Him. And we sit there and go, man, I'm over my skis here, Lord. He said, that's great. Because I'm not. And I can handle it. In Tennessee, what they do is, what does the faith community need to know? And they come down to this three ideas: of biology, of psychology, of environment. But what are some things that we can pour into people in a faith-based construct? We can help them find out who they are again. I wish we could have recorded. She and I had a conversation at the hotel yesterday afternoon. I wish we would have recorded it, because this kid totally understands what her identity in Christ is. And she's gotten that because she's been in an environment that continues to foster in her who she is. She's found out who she is. And from where she is now able to be confident as she helps other people. That is something as a faith community we can do. We can help people find out that they are not their illness, right? We'll talk about that in a little minute, about our language. They're not their illness. They are people. And how are we helping them go on the same journey that we were on, and they are on right now, in our understanding of who I am in Christ. Because I'll have days where it gets pretty rickety for me. Days where I don't feel qualified for things. Days where my need for affirmation pops up and gets in my way. Right? I have to come back sometimes and go, no, I'm a beloved son. That's it. And everything operates from that space. Right? But if somebody's out there that has had generational pain in their life, dad took off when they were 5, right? They've been living in a crazy situation for 25 years. They've been told that they're the black sheep of the family. They've been told that they're useless. They've been told that they are the problem. That they've been told, you ruined Christmas again, right? How do I bring that back to where somebody says, no, how can I be a beloved son of the Most High God? Beloved daughter of the Most High God? We can help with that. We can help with that. So a little bit about my journey. How did I get here? That lady right there is my grandmother, Clara. Clara was amazing. My grandma had 7 boys. She grew up in one of the poorest areas of Ohio. Those 7 boys, she ruled them pretty tough. But she was so tough. One of the stories I always tell when I get with folks is to kind of give you a context of how tough my grandma was. My grandma had a toddler, my Uncle Glenn. Glenn was about 2, and she was pregnant. And the time had come for her to deliver, and so they're out in the country. And so she sends my grandpa off to get the midwife, and Glenn's still running around like toddlers run around, and Grandma says, hey, this is getting ready to happen. It's going to happen whether the grandpa gets back or not. So she takes the bed, lifts the front of the bed up, puts Glenn's shirt, he's wearing like a little gown, underneath the bedpost, and slams the bedpost down so he can't move. He's trapped at the end of the bed. And then she delivered my Uncle Lester and my Uncle Chester by herself. Yeah. Lester Earl and Chester Merle. I think that resonates down here in the South, maybe. But yeah, by herself. Yeah, she was all that. One of the things that she was a deep woman of faith. And all the boys went to church, and all of us went to church. And we all sat in the same row. We all went to Northside Christian Church in Xenia, Ohio. And if your name was Delaney, you were on her row. And you were at church on Sunday morning. You were at church on Sunday night. You were at church on Wednesday. You were at her house after church on Sunday afternoon. No excuses. That's the way it was. Most of my family were in ministry. My parents were worship leaders. My dad's 87. He lives with me, along with my mom, who's 84. They led worship in the Church of Christ my entire life. They've started a Church of Christ in Xenia, where I went to church. They founded that 58 years ago. So church was a part of everything in my life. And it was just a path that I was to be on. Your last name's Delaney, this is what you do. And all of that was great. Met my wife when she was 15 years old. We were high school sweethearts. We dated for 7 years, got married, been together 34 years on the 1st of October, been together 41. She came from an incredibly difficult background. Her dad was a welder, got injured in a car accident, got hooked on opioids and Crown Royal, became an abusive alcoholic, and was really, really tough on her. And so when she saw me and decided it was okay to be with me, it was because I wasn't that. We didn't drink in my family. We most certainly didn't drink around Clara. There wasn't any of that going on. So we both went to college, went to Rat State, graduated marketing degree, got into business, and I was very successful at business. But I had a situation, a bobble in my career where I got fired, and I kind of came home, licking my wounds a little bit from losing the job, and I went down to a friend of mine's house, his name's Greg, too. And he said, you know what, I got just the thing for how you're feeling. And I said, okay, man. So we drove to the Honk and Holler drive-thru. In Ohio, you can drive through and buy beer, just get in the car. And went down there, got 2 Busch Lights, went back to his driveway and drank them. And I never looked at that as a significant moment until now, when I look back on it. Because I was under a lot of stress, and that took the stress away. It just gave me a chance to kind of breathe. Things felt better after I drank it. So I became an international marketing guy. I was flying all over the world. And the stress of that, I had a pretty big number to meet every month. And so I started to find that, hey, after work, 3 beers kind of took the edge off. And that became 6 and kind of grew. But all the while, back in Xenia, I still had Clara to contend with. I still had my church stuff to contend with, because I was also a worship leader and a deacon, and you just didn't drink. So I was drinking out of town. So Monday through Saturday, there was this guy, and then Sunday, I put my mask on and come in and do my thing. Until my worlds collided in 2001, I got a DUI. Now my drinking is public, real public. Blew a .238. Went to this thing called WIP, it was a weekend intervention program, instead of going to jail. And so when you're in the weekend intervention program, you have this huge chalkboard, and you start out, they ask you a bunch of questions about your use. They ask, how much money do you spend? What was your BAC? How often do you drink? Blah, blah, blah. There was like 10 or 15 of us in the class, and I kept winning. Highest BAC, spent the most money, drank the most often. And to their credit, they pulled me aside and said, hey man, we think you might need some additional help. And I was like, I don't need anything, I'm good. And that trajectory of drinking eventually led to 7 trips to detox, 4 trips to rehab, a complete collapse of my finances. We went bankrupt, lost my home. I don't remember 2007 at all. And the last place in the world that I wanted to be when that was going on was in church. Church was so uncomfortable. It felt so awful. And yet I'd try to go, and it got to the place where my drinking had gotten to where I'd wake up and take my kids to Sunday school. I would drive up on the hill just outside of where the church was, tell people I'm going up there to pray, and I'd get drunk. So I'd come back to church and sit in the back row so I wouldn't shake when I was taking communion. And it was just horrible. It was a tough time. So 2008, we're bankrupt. Beth's going to leave. I didn't know that at the time. Beth had started on this journey of trying to understand, my wife, she was trying to understand what I was dealing with. She went and educated herself about the disease of alcohol use. And so she had kind of come to a place, she was setting the boundaries, that kind of thing. And so 2008, that friend who gave me that beer, I was supposed to be a pallbearer in his funeral, because he, in an alcohol kind of stupor, went out to the woods and hanged himself. And so I was supposed to be a pallbearer that morning. I woke up the morning of July the 13th, and I was feeling sick like I always felt sick. And so I had gotten to a place where I was drinking 32-ounce bottles of Gatorade, but it wasn't Gatorade, it was just vodka, and I could drink that in 14 seconds. And the reason I drank it in 14 seconds so I could drink it and get it all on board so that I could time a shoot. And so I went and did that, And I woke up out of that, and sitting in a McDonald's parking lot, started throwing up blood. And so I drove myself to the hospital. I got to the hospital, I was at point 4 when I got to the hospital, 9 o'clock in the morning. And I thought, this is just like I've done all the other time. You know, you're gonna give me some vitamins, you're gonna clear my pneumonia, I'm gonna do a SEWA test, I'm gonna do all this stuff, and I'll be out. All the while not knowing I was coming home to a house that the locks were being changed, and I wasn't going to be welcome at my home. But something else happened, my liver failed. And my wife, as I mentioned, is a doctor, and she's a doctor of nursing practice, and at that time, she was the director of palliative care for the hospital that I was in. You know what palliative care is? It's the end of life care. It's ushering people to the other side. So every day, she's in the ICU having conversations with families about resuscitation, about do not resuscitate, all these kind of things. So she gets a call from her colleagues at the ICU, said, you better come down here. So she came down, they pulled the curtain back. They said, we think we should resuscitate him at least once. What do you think? Now, I shortened the story, but I had taken Beth through spending all of our money. And I spent all of our money in strip clubs and other things. House is gone. I'd driven my kids drunk. But one of the things I look back on it now is my wife's journey with the Father was on this trajectory while mine was on this. And you go back to your vows, the two will become one, right? So there was a balance there that she had come to a place that when she was posed that question, she said, I took my nurse hat off, I put my wife hat on, I went over in the corner of the ICU, and I went to the Lord and I said, Lord, he's tormented by this illness. I know he accepted you at 13 years old. I know he's going to be with you. I'm good if you need to take him. And in that time, she had made arrangements with one of my best friends in the world. He was going to raise my children. So she had already decided to do life without him. And then she said, but if you leave him here, will you please heal him? And I woke up 3 days later, and sitting in my room was a pastor from a Pentecostal church. I grew up church pride. I'm like, why are you here? There's a pastor I didn't even like. He cheated at golf. He was just not a great guy. And he's like, the Lord has told me that you're going to be my recovery pastor. I'm like, dude, I'm done. There's no way. It's like, no. That's what I heard from the Lord. I said, man, I can't. I said, you're a Pentecostal. I most certainly can't be a pastor at your church. To be this at your church. And to his credit, he had been there 10 years prior. He was the son of the largest Pentecostal pastor church in the city. He had left his wife. He had battled with alcohol use. He had a dream. And the Lord took his alcohol use away in a dream. He had been delivered. And he said, no, I believe that. 13 days later, I got out of the hospital, and he handed me the keys to the church. And we started to gather at something called Freedom Church. 7 guys in a room. That's how it started. It grew to a Monday night ministry that still meets today at my church. Still a part of that church. Was ordained in the ministry in 2009. Went on staff there for 6 years, building recovery ministry there. And so now we have about 100 folks that come on Monday night. We feed a meal. We build a nonprofit to help connect people to resources in our community that need it. Because we had so many folks coming up on Mondays